we are covering sleep disorders. There are 5 of them, and they go insomnia, sleepwalking tardiness, nightmares, night terrors, narcolepsy, and sleep apnea. The first one is insomnia. Insomnia is basically the inability to sleep. Problems falling asleep, waking up during the night, or waking up too early in the morning. About 1 in 5 adults have insomnia. It's common among women and older adults. It's also common in individuals who are thin, stressed, or depressed. Short-term insomnia cures are sleeping pills. Although they work for a while, they stop working after several weeks, and long-term use of them could interfere with good sleep. Habits that could stop insomnia are going to bed at the same time every night, sleeping in dark, quiet places, and you can avoid naps and caffeine, and you can also set an alarm clock every time in the morning. The second one is sleepwalking and sleep talking. Somnambulism is the formal term for sleepwalking, and it occurs in the deepest stages of sleep, which is stages 3 and 4. It occurs when individuals are sleep deprived, they've been drinking alcohol or other substances. It's not abnormal, and they should be awakened because they can harm themselves or others while sleepwalking. Soliloquy is sleep talking, and they make fairly coherent statements, but it may not be accurate or anything like that. So, it also causes sleep eating and sleep driving, which is pretty dangerous. But sleep eating is sometimes cured with Ambien, which is a widely prescribed drug for insomnia. The next one is nightmares and night terrors, and I have Ben and Jen here to help me out. Ben suffers from nightmares, which occurs in REM sleep, and it usually around 3 to 6 years old. As a kid, you get a lot of it, or perhaps in average college students. There's a statistic that said average college students experience 4 to 8 nightmares a year. There's an increase in nightmares when there's an increase in life stressors. So college students are really stressed around exam time or stuff like that, is when they can get nightmares. Night terrors, on the other hand, are very similar, but they occur in stage 4 of sleep, not in REM sleep. This occurs around the same age, 5 to 7 years old, and could also possibly happen to college students. There's heavy perspiration involved. They wake up in a deep sweat, sometimes emotional or crying. It's very common, so if you know anyone with that, it's not a big deal. It just kind of happens in younger kids or if you're really stressed out. The next one is narcolepsy, which basically involves the sudden overpowering urge to sleep. Sometimes people can just be walking down the street and fall asleep. They go straight to REM sleep. They skip all the stages before that, go straight to REM. They're just passed out. And they're usually tired throughout the day, even if they have a good night's sleep, but they just kind of fall asleep randomly. It usually happens most of the time for adults. It increases the likelihood when you're an adult or when you get older. It's triggered by emotional reactions, problem with your amygdala or hypothalamus. Emerges in adulthood, like I said, and it's uncontrollable. Absolutely uncontrollable. They can't help it. They don't know what they're doing. And the very last one is sleep apnea, which is a sleep disorder where individuals stop breathing because of the windpipe. Usually with overweight people, if they carry a lot of weight below their chin, it falls on their windpipe and they can't breathe, which causes their body to suddenly awake. So, or if it's not a complete blockage, they start to snore, which is obviously when your windpipe is partially closed, you start to snore, and that's basically what snoring is. So, it's loud snoring, and then soft spots where they actually don't breathe at all, and then it's loud snoring again. It can cause high blood pressure, stroke, daytime sleepiness, obviously, and sexual dysfunction. The treatments are a weight loss program, side sleeping, propping the head on a pillow, or maybe wearing a device that keeps your head up, or like a snoring device. It may be a factor in sudden infant death syndrome, which is less than a year old, where perhaps it's not their weight that's causing it, but they actually don't know the exact cause of it. But there's evidence that infants who die of SIDS experience multiple episodes of sleep apnea in the days before the fatal event. One possible explanation, obviously, but there's obviously a lot of explanations. But yeah, basically that's all the sleep disorders, and of the 5, they're all different, but definitely if you suffer from any of these, you can go talk to your doctor or research them.